Good afternoon. My name is Nancy Eaton. I'm the Nursing Simulation Lab Coordinator, and I welcome you to this short introduction video on our upcoming IPE, which stands for Interprofessional Education. We will be including disciplines from respiratory therapy, EMS, associate degree nursing program, and our vocational nursing program into a collaborative simulation on September 6th. So I just want to review a few things. First, I want to talk about the objectives of this IPE. And I know some of you have done simulations and some of you haven't, and that's okay. But it's a time to come together and work together as a team. So one of the biggest or most important objectives is communication among the team members. You are not a one-person standalone caregiver. You're going to be working as a team, okay? And so that demonstrating and communicating throughout the simulation is going to be very important. Not just with your team members, but with your patient as well, okay? And you may be responsible for doing an assessment. That's a big part of what all of our disciplines do, to know how we need to intervene. And then, of course, initiating appropriate interventions. So a little bit about the sim. I can't tell you everything, but it's about a 90-year-old lady that is in a long-term care facility. She lives there, of course, with the other residents. She is a widow, and she does have a sister, but that's pretty much it, okay? She has some health concerns, such as joint disease and heart failure, some family history of cardiovascular disease and cancer, okay? But that's the gist of, or the information you will be given that morning with a little bit more detail of a report, so you can care for your client. During the simulation, though, I will tell you her condition deteriorates, and you as a healthcare provider will need to identify those concerns and intervene appropriately within your scope of practice. All right? So there's various roles during the IPE, and I've already mentioned respiratory therapy. Most of the time there'll be at least 2 respiratory therapists at some point during the simulation. There's also going to be an EMT. These students are also in their early stages of their education, so they will be learning just as much as you guys. These are not practicing EMTs or practicing RTs. These are all students within our health science department at Temple College. We're going to have some associate degree nursing students from the 4th semester, and we will also have some of our vocational students. The different roles that will be played, the vocational nursing students will take on the role of recording nurse. And that is basically where you're documenting everything that is occurring throughout the simulation to the client. So any assessment findings, vital signs, medications that are maybe given. You don't have to give those necessarily, okay? But you're going to be responsible if someone says, hey, when was such and such given? Or when was the oxygen applied? You're going to be the one that has documented that and can go back and say, okay, when it was given, or what other interventions may have been initiated and what time and how long. We also have some of the vocational students being a nurse at the long-term care facility. Again, you will work within your scope of practice. You will have an associate degree nursing student at your side or with you in that facility, so that they can guide you and help you in whatever needs to be done. Okay? And then we have the family member. And Ms. Zanakis is going to talk a little bit more about that in a few minutes. But basically, how would you act if this was your family member? We don't want a lot of hysteria, but we do want you to show concern, asking questions, wanting to be with your family member and such. And so as this simulation plays out or progresses through, you'll know, okay? You'll pick up on those cues and figure out how that role plays throughout. So I encourage all of you, respiratory, EMS, and nursing students, to watch and listen from your faculty, any maybe pre and or post assignments that will be due. In pre, obviously in preparation for the simulation, post to assess your knowledge retainment. So come excited to participate as a team player. Just because you might have one particular role does not mean you can't help someone else if they need it, okay? But come ready to be that team player, ready to communicate as effectively as you possibly can. Come to learn. And we are excited to have this experience for you, or to provide this experience for you. And we look forward to September 6th. Take care.
So hi, we're so excited that we get to participate in this event coming up, and as a VN student you get to do that as well. So I'd like to take just a moment and give you a brief overview of what to expect as a VN student and how this is going to impact you and what kind of wonderful day that you're going to be able to experience. The first thing is that there's going to be 3 roles that the VN students are going to get to play in 2 different locations. The first role will be at the long-term care facility, and that will be the role of an LVN. The second role will be as a recorder, and that's going to be in the emergency room. And then the third role that the VN student gets to play is a family member in the EED as well. Communication is going to be essential throughout for this event as the VN in any one of those roles, to be able to communicate not only with your patient and resident, rather, it will also be important that you communicate well with your healthcare team, and that may be your RN and your EMS, as well as your ancillary team members that are going to be participating in this event as well. So specifically for communication, when you have your resident and you're working with your RN at the long-term care facility, once you're performing your assessment, and you can do a head-to-toe assessment versus a focus assessment, and if you noticed your findings that the resident needs additional nursing interventions, then you definitely will communicate that to your RN and your healthcare provider if you need to do so. But work within your scope of practice and or training based on your findings. If you find your resident does need a nursing intervention that you've already been trained for, then go ahead and do it and be a part of that active role. However, in your training, if it comes that they may need something that you have not been trained to do yet, or if it's outside of your scope of practice, that's where that communication is going to be essential, to be able to reach out to your fellow student / ADN student of the RN role and share, this is my findings, this is what I believe the patient or resident may need, and then they can go into the chart and administer those things that they've been trained for and or within their scope of practice. The other thing that you definitely would be involved in is if the resident findings, once you're doing your assessment, if you find that your resident needs emergency services, it's very much within your scope of practice to contact EMS. With that being said, again, if you haven't facilitated and haven't conducted during the program some of those things, then definitely reach out and communicate with your team from there. But you may be the one, if that comes up, to be able to notify EMS, which is very appropriate within the long-term care facility. Some of the suggestions to prepare for this IPE is, number 1, review your CPR skills. Remember what that is about and how to conduct CPR as a nurse. You also may want to review the difference between a focus assessment and a head-to-toe assessment. The other thing that you want to be aware of is to have fun, and that this is truly a learning experience for everyone. At the specific roles, once again, there's going to be three roles, 2 locations. The first role of the VN will be doing is at the long-term care facility as an LVN. Once again, as a nurse, you're going to be doing your assessments and then evaluating your findings, determining what the next step might be. And if you need, once again, to reach out to your RN, then you do that. And y'all work best together to be able to create the best patient-resident outcome possible. The next role is what we call a recorder. And this is a role that you get to do in the emergency room. What does a recorder mean? Well, basically, you're recording the activities that are going on during the emergency room. In other words, kind of a charter. You'll have pen and paper, and you're just going to write down everything that you see, when you're seeing it, and what is going on. One of the most important roles and components to the recorder is what we call closing the loop. And what that means is if you recognize something that is going on in the emergency room and you're about to chart it, then you repeat that back. For example, if someone is starting an IV and you're wanting to chart that, you would say at 9 o'clock, starting IV. And then you go on from there. So you're going to write down everything that you possibly can note with the time. Time is very important, and what it is and who was doing it. So you just write down. Don't worry about if you can't spell or have a new word or a new medication that may be coming up. That's okay. Don't worry about it. Do the best you can. Again, it's stimulation, and stimulation's for learning. The last role that the VN gets to play is a family member. Now, please understand, when you're becoming the family member, don't be hysterical. That's not the role. The role is really to be able to have someone who is the family member of the resident who is concerned and is questioning, what's going on with my family member? How can I help? Can I hold their hand? Those type of roles and responsibilities are what we expect for the VN for the family member. All in all, I believe everyone is going to have a fantastic experience. I'm so excited about the shared learning that you're going to be able to experience and learn from. We're very fortunate that we have the opportunity to do this, and we're excited that y'all are going to be able to share in that learning. See you soon. Bye.
All right, so here at Temple College we have a few EMT courses. The particular cohort that will be participating in the IPE, they will be providing essentially basic level medical care. For the first scenario from the long-term care center, we're expecting the EMTs to provide oxygen, some basic monitoring, which may involve SpO2 monitoring, waveform capnography, and those types of things. We also expect the EMTs to consider nitroglycerin sublingual if or as needed. So for the emergency department, once they arrive at the emergency department, we're expecting somewhat of a professional exchange, provide a nice report to the existing staff. From there, if the patient deteriorates, the EMTs could participate with providing appropriate compressions and ventilations as needed. So hopefully we would have other professionals in the room to provide ventilations so the EMTs can focus on adequate and high quality compressions.
Hi guys, Ms. Ship here. Just wanted to talk to y'all about the nursing student roles that are going to be you will play in the IPE that we're going to be doing. later on in September with other divisions. So your name and title is going to be on a sticker name tag that's going to be in your folder with all the information that you have. Each group is going to have an ADN student. That is, one will be the charge nurse at the long-term care facility that the patient is coming from. So you're going to help with assessing the patient there with some of the VN students that are working at the LTC. You will provide interventions as appropriate. You'll also be the ones giving handoff report to the EMS that arrives on scene with that. Some other roles, one will be the primary nurse. So you're gonna perform your assessment, obtain the vital signs, obtain information and report from the EMS people. You are also going to give your findings to the recording nurse. Safety is a major role in this one. So for example, if they're going to be using the defibrillator, you're the one that would make sure everyone is clear before shock is pushed, things of that nature. The second nurse is going to be the secondary nurse. So they'll assist the primary nurse in their roles as needed. You're going to be listening to others in the room. You're going to help gather supplies, information as needed, and then also help the recording nurse with giving them data, just so that way we can make sure everything is recorded appropriately. And then the third student in the room, ADN student in the room, is going to be the medication nurse. So that means you get to be the one that makes sure that all of the rights of medication administration are observed and done. You're going to report all the medications administered for the team and for the recording nurse. You can verbalize that a medication has been given after you have done all your steps to verify it as well. Remember, guys, a big thing through this whole skill is communication with each other, with nurses of different roles, also with your EMS and respiratory care, etc. throughout this IPE. Needed to go back and think about your management class that you have, so that way we're covered. You are aware of what your scope of practice would be as the registered nurse. Legal ethical might be a good class to kind of look back on as well. From a management standpoint, knowing what you can delegate and the people who it is appropriate for you to delegate those tasks and items to as well. So just go back, recall those things, give yourself a little refresher. This is going to be a good experience. You are going to learn a lot from it, and you're going to get to meet other students in the health sciences department within Temple College. So I really hope that y'all get everything out of this that is available for you. Good luck.
All right, I'm Donnie Sims. I'm one of the respiratory professors here at Temple College. I've been a respiratory therapist for almost 20 years. And I'm just going to tell you a little bit about our role in a respiratory situation or a respiratory emergency. So as a respiratory therapist, we're very responsible for all things airway, whether it be assisting doctors with intubations, suctioning the patient, giving respiratory treatments for bronchospasm, basically anything and everything that we need to do to take care of the patient for them to be able to breathe. Whether that be manage the mechanical ventilator, make changes based on arterial blood gases, just a general overall picture and view of what the patient looks like and what we actually need to do. So essentially in an emergency, like I said, it's kind of our job as respiratory therapists to assist doctor with intubation, to make sure the patient stabilizes, to make sure they're well, but we're able to assist with anything and everything in that situation, not just airway. So if somebody needs to switch out with compressions and there's an extra set of hands, there we are. If we need to run and grab syringes or ABG supplies, there we are. So not just airway, mainly airway, but everything in between. And that's about our scope of what we do.